coming. My name is Leah. I'm a nurse practitioner student for Maryville University, and I'm going to take a look at you and ask you some questions about what's been going on with you, okay?
Great, thank you.
Awesome. So the nurse says that you are here with abdominal pain.
Right.
Okay, and about when did that start?
Oh, it started about a week ago. Just, I don't know, just kind of hurts. It doesn't hurt all the time, but just sometimes in different situations it begins to hurt.
Okay. And it started a week ago. Where exactly does it hurt?
It's just to the right of my, I call it my belly button, whatever that's called.
Umbilicus, okay.
Okay.
Well, and were you doing anything particular when the pain started?
Actually, it's usually when I'm laying down and sleeping, and it depends on which side I'm laying on.
Does it hurt on one side versus the other?
Yeah, like I say, the right side, I think, and it seems like...
When you're laying on the right
Oh,
side?
when I'm laying... I don't remember which side. I don't remember which side it was.
Does it usually, if you notice, say, for instance, if you're laying on your left side and it starts hurting on your right side, do you notice that if you turn onto another side that the pain is relieved?
Yes.
Okay, great. And what does the pain feel like?
It's pretty sharp, you know. I guess on a 0 to 10, and when it's hitting, it's probably hitting at about an 8.
Okay, and so does the pain wake you up at night?
Yes. If I roll over into a different position, it does wake me up.
Does this pain ever occur during the day?
Occasionally, I can feel it, but I'm moving. It feels like if I move right away into a different position, it goes away for the most part. Yes.
Okay, so at its worst, the pain is an 8.
Correct. It's usually when I'm sleeping.
Okay.
It wakes me up.
And so is my understanding that this pain never occurs during the day?
No, like I said, just occasionally. It depends on what I'm doing. If I'm
okay.
in a...
But you can maneuver yourself and change positions,
right.
And then the pain will go away.
Right.
Okay. With this pain during the night or during the day when you have it, do you ever have any nausea or vomiting that is associated with it?
I've not thrown up, but I do feel nauseous.
Nauseous, okay. What about your bowels? Have your bowels been regular? Any problems with diarrhea or constipation?
Not that I've noticed.
Okay. The pain is sharp. Would you say it's more to the surface of the skin, or does it feel like it's more internally or deep?
Deep, more internally.
Have you noticed any like abdominal distension, like your belly is bloated, or that you have gas that you can't get rid of?
No.
Okay. Have you gained any or lost any weight unintentionally recently?
No. But my weight tends to stay very stable all through my life. So.
Okay. All right. Great. What about foods? Do you notice that if you eat a certain food, is there an association between eating a certain type of food and then the symptoms that will occur during the night?
Huh.
Or maybe the time of day that you're eating?
You know, I haven't noticed that. I apologize. I have not paid that close attention to it.
That's okay.
I can start paying attention to that, though.
Okay. And so about how many times a night does this, when you have the pain that wakes you up during the night, how many times a night does that occur?
Probably averaging about two times a night.
Two times a night, yes. That wakes you up?
Yeah, last couple of days it's been.
Okay. Any problems urinating?
No.
No problems getting started, or it burns, or it hurts, or any pain in your back when you're urinating?
Not that I've noticed.
Okay.
But again, I can start paying attention to that.
Okay. All right. And then, like, your past history, health history. Any surgeries on your belly, your bowels, your bladder, or any surgeries on your belly?
The only surgeries that I've had my tonsils taken out. I had tubes in the ear when I was a kid 3 different times. I think those are the only surgeries that I've had done, other than oral surgery.
Do you still have your gallbladder?
I do.
What about your appendix?
I do still have that, yes.
Have you ever had a urinary tract infection?
No. That's where, isn't that where, what is that?
It's an infection between the kidneys and where the urine comes out, your urethra.
And how do I tell if I have one?
You would have a burning sensation when you urinate. It would feel like, even though you went to the bathroom, it'd still feel like you'd had to go, and sometimes there's blood in your urine when you...
I've heard of that. No, I've not.
Okay. And sometimes you can have back pain when you're urinating as well.
Okay.
Okay, ever had cancer?
No.
And you're up to date on your immunizations?
Yes.
Okay, have you ever had a blood transfusion?
No.
And have you ever had pain like this before?
Not like this, no. This is unique pain.
Very good. Okay, so we'll go over your family history with your immediate family, and then your social history. Okay. Does colon cancer run in your family, as far as you know? Like immediate family would be your mom, dad, brothers, sisters.
No, not immediate family. No.
Okay. What about gallbladder disease? Do you know if your parents or your siblings have their gallbladders?
Not any problem with that. The only thing I've had is I had one brother who had pancreatitis.
Okay. Gallbladder, did you say? Yes.
No, there's no.
Okay, sorry.
No history of gallbladder.
Any kidney disease in your family?
No.
Okay. Any malabsorption diseases in your family, like Crohn's or any bowel disorders?
No.
Okay, and your appetite, how has your appetite been?
I always love to
Generally.
eat. So it hasn't affected it really.
Okay. Do you try to eat a well-rounded diet?
I would give my diet like on a scale of 1 to 10, I give it about a 4. I'm pretty bad about that.
Okay. What about fiber in your diet?
What's considered fiber?
Any fruits and vegetables with the skin on it, whole grains. There's supplemental fiber like Benefiber, Metamucil.
No, I don't take anything like that.
Okay.
I like fruit, but I don't eat as much as I should.
Okay. And so your appetite's pretty much stayed the same through all of this abdominal pain?
Mm-hmm.
Okay, great. Have you had any major changes in the types of food that you're eating or the times of day that you're eating?
No.
You're not staying up extra late or going longer periods of time without food?
No, I don't believe so.
Not eating more types of greasy foods or fried foods?
I do eat on the run, and I'm very busy. I hardly ever sit still, so I'm usually a lot. There are many times I go through a drive-through and I eat while driving. So yeah.
Okay. Do you take probiotics?
No, I take a multivitamin.
Okay, all right. And then has there been any changes in the amount of, do you consume alcohol?
I do.
Do you consume more than socially?
What's considered socially?
Just 1 or 2 drinks a day?
No, I don't.
Maybe 3 or 4 times a week? Okay.
No.
And then what about illicit drug use?
No, I don't use drugs.
Okay. Any major lifestyle changes or stressors recently? New job or changes at work or?
Well, we have a kid coming along here pretty soon, so yeah. I don't know if that's stressful. I'm excited about it, but
Okay. And any recent travel outside of the United States?
no.
And smoking use?
Yes, I smoke occasionally.
All right. Well, that will conclude our history taking of your present illness. We will order some tests and try to figure out what's wrong with you.
Great.
Thanks.
Thank you.